Fatigue is defined as any decreased capacity to perform physical actions. According to Anoka, who mentioned this definition, there have been very few confirmed measures to test fatigue. But EMG has been one of the few outcomes that are well tested and utilized. EMG readings have a couple of characteristics that define when an individual is reaching fatigue. The amplitude of the activation of motor units increases, and the frequency at which these motor units are firing decreases. This increase is due to motor recruitment increasing. This is because in order to maintain a contraction, more and more motor units will need to be activated in order to support that contraction as other motor fibers start to fatigue. This study evaluated the effect of this fatigue on submaximal contraction, and we measured flexors and extensors of the wrist muscles as they did a grip strength test. We expected to see a gradual rise in the percent of maximal contraction activation as time went on, due to the increased demand for more motor units. The procedure included obtaining a maximal voluntary contraction and an EMG measure at this maximal voluntary contraction using a dynamometer and the EMG. The subjects then were asked to maintain 25% of the force performed at max for as long as possible up until 5 minutes have passed. The results obtained demonstrated that extensors and flexors both decreased in their percentage of maximal activation as time went on, with flexors decreasing at a larger rate. Also, a few of the subjects dropped out at various times as they reached fatigue. Our results actually did not support our hypothesis that the amplitude of EMG would increase over time during a submaximal fatigue and contraction. Unfortunately, this data is also largely unsupported by other research, indicating that our research was probably not valid. However, there are several reasons why this could have occurred. According to Volostad, a researcher, during motor unit recruitment, because we're recruiting different types of motor units and muscle fibers, the amplitude of the EMG can actually be very variable and kind of oscillate, which may have led to an inconsistent dramatic trend line as fatigue occurred. Also, this study had a huge amount of room for error due to the novelty of the measurement for the students, and because every subject was tested by multiple new researchers, different researchers for every subject, which means that our data was probably very variable and not reliable. This study is relevant because it shows, first of all, we have to be careful when we use EMG because it could be incorrect, it could be invalid. We just have to be careful with the way we use this very touchy instrument. However, also, it is very important that we can use this in a clinic because EMG readings can provide some information about the state of fatigue of a patient when it is performed correctly.